Okay, this is my patient Shirley Cotton. She is doing lumbar decompression. She's done several cycles already, and the first thing I would like to ask you is, has decompression benefited you as far as your clinical condition that you came in with prior to doing the decompression?
Absolutely.
Okay, so your symptoms initially were obviously low back pain. You had a lot of weakness. You had dizziness, or not dizziness, balance problems, correct?
Balance problems, hip. My hip really bothered me and radiating pain down my leg. But with your manipulation and with this procedure, really, that just basically went away. And it's still gone. I don't have any hip problems. I don't have any radiating pain going down my legs.
Okay. So one of the things I told you from the beginning and that we talked about and sometimes we struggled with was that this is a teamwork. It's a combination of things that we need to do for your condition, which includes exercises. And I know you're completely on board because your house is like a gymnasium now.
That's for sure.
But that's the point, is that we don't treat a spine, we change a spine. And the way that we change a spine is we have to re-educate the way the spine moves and the way that the muscles hold it in position. For example, if we just stretched you and we didn't re-educate the soft tissue around the spine, your relief would be temporary at best. But in addition to the decompression, we're doing manipulation to alleviate the rotation and all kinds of different positional things that are wrong with the spine. And you re-educate the muscles both here in the clinic and with what you do each day at home.
That's for sure.
Is that correct?
That's correct.
Okay, so it's a team effort and it's little steps each day. And how are your symptoms now? Do you still have bad and good days, or are you doing?
My days are great.
Okay.
I have very, very little discomfort. The only time I might have some discomfort is when I'm walking those dogs, if they pull me in two different directions. You know, or if I twist. But if I have any discomfort, it goes away within a day. But it is just remarkable what this has done.
Good. Glad to hear that. Can you just explain for people that are listening how bad your pain was when you first came in and some of the doubts you may have had about what we were going to be able to do as far as treatment is concerned?
Well, as you know, before I saw you, I had physical therapy because I was diagnosed with a spinal stenosis. And I could hardly walk, if you remember when I first came in here. Just getting out of bed was a challenge. And as I said, I have the two dogs that I'm responsible for and trying to walk them. It was almost impossible to walk them the way they needed to be walked. But little by little, you know, with your manipulation, and then I did have some concerns about this procedure. But as you know, I did a lot of research, talked to other people, and I just felt this was just something that would definitely benefit me, and it certainly has.